Which receptor helps in improvement of insulin resistance in diabetes 2 with regular exercise and physical activity? Glucose transporter 1, glucose transporter 2, glucose transporter 4 and glucose transporter 3. So let's discuss a brief about glucose transporter. So GLUT or glucose transporters, they are facilitative glucose transporters. Facilitated diffusion is the main mechanism of glucose transport across the cell membrane. Glucose movement is predominantly due to the concentration gradient and there is no requirement of ATP. So now we will discuss about these glucose transporters separately with their primary location and special function. So glucose transporter 1 is widely distributed in the body, primarily on RBC and blood-brain barrier. This maintains the steady level of glucose. Glucose transporter 2 predominantly present on liver, kidney, pancreas and small intestine. This glucose transporter helping regulate insulin secretion. Glucose transporter 3 predominantly present on neurons and placenta. This transporter has high affinity for glucose and that's why this transporter helps to maintain a steady level of glucose in these vital tissue. Glucose transporter 4 primarily present on adipose tissue, skeletal muscle and heart muscle. This is an insulin regulated transporter and plays an important role in insulin resistance, diabetes mellitus. Glucose transporter 4 primarily present on testes, kidney and small intestine, play an important role in fructose transport. As we know, fructose is a primary fuel for the sperms. SGLTs or sodium glucose linked transporters, they are the secondary active transporters. They require ATP for glucose transport. SGLT1 is present on apical membrane of small intestine and renal tubules, which plays an important role in glucose absorption from the intestine and reabsorption from the kidney. SGLT2 primarily present on the proximal convoluted tube of the nephron of kidney, play an important role in bulk reabsorption of glucose from the glomerular infiltrate. Some blocker of this SGLT2 transporter play an important role in treatment of diabetes mellitus. SGLT3 primarily present on intestine, testes and brain. This particularly act as a glucose sensor. So coming back to the question, which receptor helps in improvement of insulin resistance in diabetes mellitus type 2 with regular exercise and physical activity? So as we have discussed, GLUT4 is primarily present on fat, skeletal muscle and heart muscle, and this is an insulin dependent glucose transporter. So this will be our answer. Thank you.